everyone has a lot of questions about what does Botox do for the skin and the muscles and aging. What it does is it relaxes the muscle. So how the mechanism of action for Botox, Dysport, Xeomin, all of the neurotoxins, they all do the same thing. They just compete for each other's business. But how it works on the body is interesting because it blocks the acetylcholine that tells that muscle to not move anymore. And so we are doing a precise injection into an area to relax that muscle to smooth those lines out. And so that's why it's important to go to a certified injector that is knowledgeable with muscle movement, dynamic movement, because there's certain ways that we would inject it. If the muscle is really strong, we want to be really in the belly of the muscle. If we want it to be more superficial on the we might go a little bit more superficial. So you want someone who has a lot of experience and understands the muscles, the movement of the face, the anatomy of the face. And so what Botox does is it's going to relax and smooth those fine lines for a temporary period of time. Generally, it's 3 to 4 months. Some people might get a little bit less if they exercise a lot. Some people may get a little bit more depending on your body chemistry. We offer a lot of products here. We're not exclusive with one company. Allergan does Botox, Galderma does Dysport, Merz does Xeomin. There's a lot of products out there. We currently at Zona Med Spa offer Botox, Dysport, Xeomin. We have Jeuveau. We have Daxxify. We also have Latibo. So we carry everything because not one person likes one product. With Botox, Dysport, Xeomin, a lot of people will call and say, oh, I want Botox. The reason that is because Botox has a brand. It was the first one on the market. And so they have the brand name that's out there. And so they all are great products. The difference between those products are what we call accessory proteins. So think you have 2 pieces of chicken, organic and inorganic. Your inorganic is going to have a lot of accessory proteins like hormones, antibiotics, and additives. So in Botox, it has the highest number of accessory proteins. Xeomin has none. Dysport, the other ones, it's all in between. So if someone is more of a natural person that doesn't want any additives or anything like that, then we would say you might want to use Xeomin because it's the cleaner product. But essentially, if you go to the grocery store and you're going to buy Kleenex, you're going to buy whichever brand you're comfortable with. If you're going to buy toilet paper, you're going to buy 2-ply, whichever brand is usually on sale. So they all are essentially going to do the same thing, same risks, same results, same side effects. I tell everybody, you give me a watercolor set and ask me, Michelle, which one are you going to use? It depends. I might, on your specific case, I might use Dysport in one area, Botox in another, Xeomin in another. At the end of the day, it's all personalized with what you want. And for me, my cost is the same with my products. So if we have a coupon on one, I might recommend one over the other because it's going to save you money. I get the same risks, same results, same side effects with all of these products. So at the end of the day, I want you to save money. So if it's going to save you money, why wouldn't we do it? Because it's all safe. They just could compete for each other's business. I stand behind all of my products. So if you have a problem or you're not happy, you're not going to call that drug company. You're going to call Zona Med Spa. You're going to call me. And I'm going to back that product because I believe strongly in the products that we offer are going to give you the result that you're happy with. So the most common areas that we treat with the neurotoxins like Botox, Dysport, Xeomin, the most common areas, we will treat the chin for the orange pill chin, or if their chin goes up, we will treat the chin. Units vary by person. We can do the masseters. So if you want a more slimming jawline, or you want it to be a little bit smaller because you've built up those masseters from chewing or grinding or whatever the case may be, we can do the masseters. If you want your neck to be thinner, we might do the masseters, we might do a little on the jawline, and then we'll do your platysma bands, and that will kind of help tighten the neck a little bit. If you have a lot of loose skin or you have a lot of adipose tissue, Botox is not going to fix that. That might be a surgical option. Also, we can do Botox for areas such as the crow's feet. Sometimes if someone has they smile and they have a little bulge right here, we'll treat called the jelly roll to relax that line. The bunny lines is a good area if people have the little lines that go across their nose, that go up between the glabella and the nose, we'll treat that. If they don't like these lines on their nose, then we will treat the bunny lines across the nose, and it's usually 3 injections. We can do it for the lips if you want to get a little lip flip to turn the lip up. If your nose goes down, we can always do a few units here to turn it up. There's another option that we have if people have a gummy smile. So people that smile real big and you can see their gums, we can inject a couple units up here and that will help with that gummy smile. And then I have a lot of people that say, hey, how do I have this frowny face. Can I put Botox down here? You can, but there's a caveat to that. You want to be very cautious when you're treating the DAO because if you hit the wrong muscle, it can cause your lip to go up. So not everyone is a candidate to treat this area. We do it for the right candidate, but sometimes filler is a better option for that area. Also, when you're treating for the DAOs and the lip flip, it's not going to last as long. You might only get 4 to 6 weeks out of it, and that's because you're using your lower face so much, you're gonna metabolize that product quicker. The other area that people like is a brow lift. So normally when I do my brow lift, I like to treat a little bit in the glabella, a little bit in the glabella. So for a brow lift, glabella, a little on the crow's feet, and then into the brow itself to get the most lift. And then sometimes I might do an injection at the top up here. If they just want a brow lift, then they don't want to do any in the glabella, then I might just do a little in the brow and then a little on the crow's to get the most lift. The other option is if you got those really deep 11s here, depending on how deep they are, I'll do some Botox here, and then I might do a little laterally here because you might get some pull down. So it depends on that person's anatomy on how we do the injections in that area as well. If those lines are really deep, with a qualified, experienced only injector, you can inject the glabella, but you must be extremely careful when you're doing that with filler. The other thing is across your forehead, that is another option that we can treat is the forehead. Generally, most people are treating the glabella and the frontalis at the same time because they want to get the most lift open of their eyes and smooth to have porcelain glass skin looking up there. So a lot of people will call the office and ask, how many units do I need? What products should I use? Well, unfortunately, the front desk are not providers. So they know the basics of the products, but they don't know how many units you're gonna need. Everything is done with a personalized assessment that is to your goals, your expectation. We want you to get results that are going to be extremely happy with. And so with Botox, Dysport, Xeomin, the dosages are a little bit different. The injection points may be a little bit different. Placement might be a little bit different with the products. So that's why we recommend you coming in for a consultation, because maybe your friend uses 20 units of Botox, but you might only need 10 or you might need 30. We don't know until you come in and do a consultation for us to determine which is the best for you. So let's talk cost. A lot of people are having questions. They'll call the office and say, hey, how much do you charge per unit? How much do you charge per area? What's the cost of Botox? What's the cost of Dysport? So let's kind of like back it up a little bit. So cost is going to vary from person to person, depending on how many units you need and what product you're using. Generally, the cost to do treatment is going to be between $250 and $300 per area. A lot of med spas will dose by unit. They will dose by area. Depending on the product that they use. So I always tell everybody, we're going to cater it to your needs and your expectations and what you're wanting. If you want to be really tight and firm, then you might use a little bit more units than somebody else who wants to have a little bit of movement. So I tell people, like, what are your goals? What are your expectations? You know, someone will call me and say, hey, I found Botox for $9 a unit. Well, that's a great deal, but that $9 a unit, they could be over diluting that product. They could be using an imported product. That's why it's important to go to a med spa or an office that you know they're using a legitimate product and it's not something that is illegally imported or they're over reconstituting that product. So that's the one thing, like, you're gonna know when you come to us that you're getting A, a legitimate product, B, we have a good reputation, C, you're getting a good price for our expertise in this industry. So I tell everybody, if you're coming in for a treatment, let me just walk you through the process. You're gonna call, you're gonna book your appointment. You know, you can either book it online or you can call the office. The other option is you can also send us an email. So regarding coming in for your appointment, it takes about 10 to 15 minutes max to fill out your paperwork, for us to do the injections, for us to give you post-care, and for you to check out. You know, I've been doing this for a long time, so I'm very quick and efficient with how I do my injections. I have some people that are very, very busy and they need to be in and out in 10 minutes. If you already got your paperwork filled out, you come in, you walk to my room, I can have you out of here in less than 5 minutes. But If you're a new client, I might need 30 minutes with you because I need to educate you and have you understand the process. Make sure you understand post-care, pre-care, all that. So I tell everybody, if you're an established patient, most of my patients come in on a lunch break and leave. But you have to make sure that you understand your post-care. You have to make sure that you understand if you have any questions, we want you to follow up with us. So with that being said, once you're established, I can have you in and out in less than 15 minutes. So there's a lot of controversy out there about how long it takes for a product to kick in. I have some people that when they do Botox, they fill it the next day. Some people do Dysport, they say I fill it the next day. So really it depends on your body's chemistry. But generally I tell everybody, you'll start to notice a difference usually at about 4 or 5 days, but it will take up to 2 weeks to see your final result. So you can't say that it completely kicks in 100% the next day. It just does not happen. But give it a few days. Some people see their final results in 3 or 4 days, but it depends on your body's chemistry at the end of the day. But I tell everybody still give it that 2 weeks to make sure it's all kicked in before you do any touch-ups or complete evaluation of that product. How long do results last with neurotoxins like Botox, Dysport, Xeomin? I tell everybody your results can last anywhere from 3 to 4 months. Depending on if you exercise, if you do hot yoga, it may not last as long. If you have a high metabolism, if you take Adderall, it's not going to last you as long. But for the general public, you're going to get 3 to 4 months out of it. And then you have those really lucky people that they're going to get 6+ months out of it. But that is very rare. When your neurotoxin wears off, your lines are just going to come back. It's not going to come back worse. You're not going to look worse than you did before. You're going to look the same. You might look a little bit better until it's completely gone, but it's only going to relax that muscle for a certain period of time, and then those lines are just going to come back. So this is not a permanent solution. It is a temporary solution for a short period of time, but the lines that come back, they're not going to come back worse. Botox, Dysport, Xeomin, all of those products generally will last about 3 to 4 months for the general population. However, if you are taking Adderall, if you are exercising a lot, hot yoga, things like that, you may metabolize your product quicker and it may not last as long. I do have some people that it can last up to 6 months. However, that is not the norm. Generally, I see my clients 3 to 4 times a year. So if you're budgeting to do your product, I tell most people, talk to your provider. Ask them, hey, can we put a treatment plan together that fits my budget? Because we have some people that are on a budget and they only can afford so much, but they might want to do a lip filler with their Botox. So we will find a treatment plan for them that fits their budget and just plan the year out accordingly. There's currently nothing that is approved to reverse a neurotoxin like Botox, Dysport, Xeomin. However, if someone has something that they're not happy with and they don't like the injection, or the injection was placed improperly, or they accidentally migrated there, they can always come in, we can assess them and determine if they're a candidate for some other alternatives that are not FDA approved but have worked a little bit in speeding up the process of metabolizing that product. When people come in, people will call and they're really nervous about getting injections. They've seen things on social media or online of an adverse event that has happened, a droopy brow, things that they weren't happy with. So that's why it's important to go to a certified injector and someone who's qualified and has experience and has the proper training to come in and do a consult, because you may not be a candidate for injectables for whatever reason. Maybe you have a medical issue and you're not a candidate. Maybe you're pregnant or breastfeeding. Maybe you're on antibiotics. Not everybody is going to be a candidate. And some people, as you're older, you might be more of a surgical candidate instead of doing a Botox or a filler. So I always tell everybody it's really important to go to an injector, because sometimes we do tell people no, they may not be a candidate for a neurotoxin at this time, and they might need something else, a more surgical option, or they may not just be a candidate for it for a medical reason. So when clients come in, we're trying to determine, from an age standpoint, we say 21 is an age standpoint that we usually would treat somebody with Botox or fillers. So one thing that we have is most of my clientele are anywhere between probably 28 up to 85 years old. So it depends on the person, the skin laxity, have they had surgery, what's their goals, what's their expectations. Everything is individualized with us. So it's not one size fits all. It depends on what that person's goals and expectations are, and whether they're more in line to do a surgical route than a Botox route at this point, or a filler route at this point. So we give everybody an individualized treatment that what works for you at that time. Because if you're a young person and you're 25, 30 years old, you might only need 25, 30 units of Botox. However, if you're 45, 50 years old, you're probably going to need more like 40 to 45 units. It just depends on what areas you're treating and how dynamic and strong your muscles are and what your goals and expectations are. The risks of someone having an allergy, I have not had anyone have an allergy to any of these products in 16 years. If you do have a sensitivity to cow's milk protein, that's not dairy, that is cow's milk, then you probably wouldn't want to use Dysport. But other than that, all of these products are safe and FDA approved to use. Any type of neurotoxin, there's always a risk of bruising, temporary swelling for about 15 or 20 minutes after your treatment. Some people can experience a headache. Some people can get a little blurry vision if it's injected too closely to the eye. There's always, an adverse event where the outcome isn't what they want. If that's the case, then that's why you need to go to a certified injector that has a lot of experience.